The ATLS course is an intensive training for doctors on how to rapidly assess and treat trauma patients during the initial golden hour after injury. The structured approach of ATLS aims to stabilize life-threatening problems first, through treating the ABCs airway, breathing, circulation before addressing less urgent issues. Taught across the world since the 1980s, ATLS provides standardized training using lectures, skills stations and simulation. While originally designed for emergency physicians, the principles now extend to all acute care doctors and first responders. The general overview of ATLS teaches prompt assessment and resuscitation along with communication and teamwork. The first priority is to conduct a rapid primary survey to identify immediate threats and stabilize the patient enough for further evaluation and treatment. This involves assessing and managing the airway, breathing, circulation, disability and exposure/environment. To assess the airway, providers look for obstruction, fluid, debris, swelling, bleeding, or facial trauma. Basic techniques like chin lifts, jaw thrusts, and suctioning are used to establish airway patency. If needed, definitive airways like intubation or cricothyrotomy are performed. Oxygen is also provided to hypoxic patients. Breathing is evaluated by inspection, auscultation, and pulse oximetry. Chest decompression, endotracheal intubation, or positive pressure ventilation may be required in cases of respiratory insufficiency or compromise. With circulation, providers check pulse, skin signs, and mentation for adequacy of blood flow. Bleeding is controlled with direct pressure, tourniquets, or hemostatic agents. Fluids and blood products are given for hemorrhagic shock. Pelvic binding, mass trousers, or reboa may be considered for unstable pelvis and abdomen. Chest ECG and ultrasound identify cardiac tamponade amenable to pericardiocentesis. Neurologic disability is quickly gauged via the AVPU scale, pupils, and glucose check. Spinal immobilization is applied for those at risk of cord injury. Brief head-to-toe exposure examines for other injuries while preventing hypothermia. Temperature control is maintained for all patients. After the primary survey establishes stabilization, the secondary survey obtains history, performs a targeted exam, and orders diagnostic studies. Reassessment monitors the patient's response to ongoing treatment. Definitive management and disposition is coordinated for the trauma center. ATLS also covers principles related to trauma systems, transfer, transport, psychology, and end-of-life issues. Effective communication skills are emphasized throughout. In terms of practical skills, ATLS trains hands-on procedures like chest tube insertion, pericardiocentesis, airway management, ultrasound, and safer patient moving techniques. Realistic simulation with high-fidelity mannequins allows learners to apply ATLS concepts in immersive trauma scenarios. Some examples of ATLS principles applied: a motorcycle crash victim arrives with heavy bleeding from facial lacerations. ATLS principles dictate controlling the airway first before definitive repair of wounds. The team suctions blood from the mouth, inserts an oral airway, then packs and presses the wounds to stop further blood loss until the airway is secured. An elderly driver is brought in after a motor vehicle collision. She is unresponsive with irregular slow breathing. Following ABCs, the team immediately inserts an oral airway and ambu bag to support ventilation while applying a cervical collar and spinal immobilization. A construction worker falls 2 stories onto concrete rubble. On arrival, he is pale, diaphoretic, and confused with a thready pulse of 110. After rolling log roll, no obvious bleeding or injury is seen, so the focus shifts to assessing circulation. For fluids are initiated along with pelvic binding for a suspected occult hemorrhage. A stabbed victim has a sucking chest wound audible on breath sounds. Following ABC principles, a chest seal is placed to allow lung re-expansion. Vital signs improve and no further interventions are immediately needed. In summary, ATLS provides a structured approach for the initial evaluation and management of trauma patients. The principles of airway breathing circulation, rapid primary survey, addressing life threats first, then secondary survey guide providers to stabilize patients efficiently and effectively in the critical hour after injury. The techniques taught improve trauma outcomes and save lives.